At the Old Town office of the nonprofit Diegans for healthcare coverage, Rob Keller is trying to choose a health insurance plan.
So this is every 2 weeks, or how?
Correct, every 2 weeks, based off of $9 an hour.
Determining Keller's annual income from his job as a waiter is key to finding out whether he's eligible for free Medi-Cal coverage.
You might default into Medi-Cal with that.
Or a discounted Covered California plan.
You know, I've had health insurance in the past just because I was with my company, but I never really, used it or needed it. I don't go to the doctor that much.
Qualify for the silver.
Even so, Keller says a February 15th deadline caused him to get with the program.
I didn't want to have a penalty for getting nothing. I might as well pay money to have health insurance.
Over 17 million Californians get health insurance through their job. For Keller and the more than 6 million Californians who don't, February 15th looms large. By that date, they must be enrolled in a plan, or they'll face a federal tax penalty on next year's return. The penalty will be $975 per family, or 2% of annual household income, whichever amount is greater. San Diego State professor of accounting Stephen Gill says that's not a lot of money.
We'd rather pay nothing than something, but it's unlikely that anyone would have to go bankrupt because they ended up having to pay the penalties and the fines associated with the Obamacare.
Gill says, as it turns out, the law prohibits the IRS from pursuing civil or criminal penalties to collect the Obamacare fine.
The IRS isn't really going to pursue you with any rigorous enforcement, even if you don't pay it.
The IRS will simply subtract the penalty from any future refunds. But that's not really the point, says Jan Spenceley, who directs San Diegans for healthcare coverage.
I think the biggest penalty is not having coverage and not having access to care.
Spenceley points out no one knows when they're going to be sick or have an accident. She says without insurance, one trip to an emergency room can mean financial ruin.
So people really need to understand that there's value in insurance. It limits your liability, it gets you free preventive care, and it also makes sure that you don't have small things turn into large things.
Mom's chili.
Better than Dad's chili.
Dad's gonna make rice.
Nonetheless, local banking executive Toby Hayes and his wife Stephanie have decided to roll the dice.
You got stickers everywhere.
Their 6 kids are covered under Medi-Cal, and Toby gets insurance through his job, but Stephanie is uninsured. Toby says it was just a matter of finances.
For the basic bronze level plan for Stephanie, it was going to be like $4,000 for the year. It comes out to like $334 a month, versus what we paid in the penalty, which was $763 for the year.
They're aware that the penalty will be higher in 2015, but Toby says it's still cheaper than buying health coverage.
Alyssa, give me a chocolate milk.
Stephanie doesn't think she's taking a big chance by being uninsured.
I've always been a very, very healthy person, and if tomorrow I come down with cancer, then we're going to figure out something when we get there. But right now, I hate wasting money.
But for people who believe health insurance is valuable and want to avoid a tax penalty, the deadline for enrolling in a covered California plan is less than 2 weeks away. Otherwise, whatever health issues crop up, people have to wait until the next open enrollment period to sign up. Kenny Goldberg, KPBS News.